For the community responder, there are 3 phases of assessment during an emergency: the scene size-up, the initial assessment, and ongoing assessment. The scene size-up is a quick assessment of the environment for hazards and the number of victims, as well as determining what may have happened. After making sure the scene is safe, try to determine how the event occurred. Consider the mechanism of injury or the nature of the illness to identify potential injuries or symptoms. Suspect that a serious injury occurred in any of the following situations: a vehicle or motorcycle accident, a person is hit by a vehicle, a fall greater than standing height, bicycle crashes, and explosions or gunshots. When the emergency is a medical problem, check the scene for clues, such as prescription bottles, a medical alert tag, or an inhaler. Ask about the person's medical history. During the initial assessment, you will look for and treat life-threatening conditions such as unresponsiveness, difficulty breathing, or severe bleeding. Assess the victim in the position found. First, assess response. If the victim appears unresponsive, tap them on the shoulder and yell, "Are you all right?" If they do not respond, have a bystander call 911 and get the first aid kit and AED if available. Go yourself if you're alone with an adult victim or someone who doesn't need immediate care. Scan the chest for breathing. If there is no breathing or only gasping, start CPR if you are trained, or chest compressions alone if you are untrained. If the victim is alert and responds with blinking, talking, moaning, or moving, continue the assessment. Introduce yourself. Tell them you are trained in first aid and ask if you can help. Ask the person what's wrong. Look for obvious signs of injury such as bleeding, burns, bruises, swelling, or twisted limbs. Treat injuries as needed. If there is no sign of injury, look for an illness. Check for a medical alert bracelet or necklace which might indicate diabetes, seizure disorder, asthma, or allergy. Treat life-threatening problems first. For example, if the victim is bleeding severely, apply firm, direct pressure with a gloved hand to control it. Send someone to call 911. If you're alone, you'll have to go call. The ongoing assessment is circular. Once you've established treatment priorities, reassess scene safety and reassess the victim. Remember, if the scene is not safe, then don't enter. Once at the victim's side, assess for response and start compressions if not responsive or breathing. Treat life-threatening problems like severe bleeding first, then assess for other problems. Make sure the scene remains safe and that help is on the way. Let's practice.